let's get a medical response to the measures announced by the President this evening. I'm joined by Dr. Kerrin Begg, Public Health Specialist from the College of Medicine at the University of South Africa. Good evening. Thank you very much for joining us. So, there was much talk before this announcement that we needed to be proactive about preventing any sort of super spreader events. So all we have seen actually is a 4-day ban on alcohol sales from a retail level. And we've actually seen an increase in gatherings for religious purposes. Do you think we've been proactive enough here?
I think it was a tight line to walk. I certainly think that we'd possibly expected a little more on the gatherings, on restricting gatherings. However, this is still quite restrictive, versus what we usually see over Easter, particularly for the very large gatherings in the north of the country. So this will still be a significant restriction. And what we're really trying to do is limit those spreader events. And so I suspect it was also a reminder, more than added restrictions. Really, just a reminder to say that these gatherings need to adhere to COVID protocols. We need to be avoiding the 3 C's of close contact settings, crowded places, confined spaces. And so I think that it was a bit of a compromise on slightly increasing the size of religious gatherings that in a sense appeases people, that allows a little bit bigger, but not the thousands of worshippers that would have gathered in years gone by.
So the President's saying as well that for the past 2 weeks, the infection rate has pretty much stabilised. It looks like the second wave is well and truly behind us. But also we all remember what happened with the rage festivals when that seemed to spark our second wave. Do you think that there is a risk, bearing in mind that you add alcohol to any social gathering, and it can, as the President says, fuel reckless behaviour? How much of a risk do you think there is? You're quite right that the big church gatherings are not going to happen, but nevertheless, families are going to be getting together.
And I think that is always the risk when, so we're now at the same levels that we were at in September and October last year. And the same kind of things happen, is that as soon as we are not hearing of family, community members, co-workers who are around us with COVID, sick in hospital, all of that sort of dies down, and our memories are very short. And we tend to forget, and we tend to relax the vigilance that we've had before. So that is a significant risk over the weekend, and that's why I think that an announcement that the President has made tonight was perhaps made as close to the weekend as it has been made, with only 2 nights to go, instead of perhaps being made on Sunday, really as a very strong reminder and message of the fact that we still need to retain that vigilance, be wearing our masks, limiting our contact within our biobubbles, and sanitizing, etc. So I think that there was perhaps a bit more on the communication side and a bit less on the restriction side, just a reminder of the restrictions that should remain in place, because essentially the rages, etc., shouldn't have happened at the end of last year either, because those were in fact in contravention of restrictions that were in place at the time. So there is a risk always as we start to relax and we start to gather. It's still summertime, but it was also summertime with outdoors, and that didn't necessarily prevent the triggering of the second wave. I think that what we do need to bear in mind is that obviously right now we are keeping a very close eye on variants, because that caught us a little bit by surprise at the end of last year. And that was a huge factor in the second wave, and particularly in the magnitude of the second wave. We have been keeping track, and there don't appear to be any significant variants at the moment. So that for us is good news. A third wave we would expect around May, June. Obviously, Easter could trigger a slightly earlier third wave if people don't adhere to the measures that we should be adhering to. But then we don't have another variant. So that would be some good news. And we've certainly seen in some of the evidence that some areas were able to retain some population immunity. And so that was really encouraging. Some of the work, particularly out of Khayelitsha, which were particularly hard hit in the first wave, actually had some measure of protection through the second wave. And so we hope that may protect us from the amplitude and magnitude of the third wave. Yeah. Obviously, we would have liked to have had vaccination a little bit further down the line, but we certainly wouldn't have been in anywhere close to population immunity from vaccination by May, no matter how fast we'd got things off the ground. But certainly we would have liked to have been a lot further down the line now.
Yeah, and Dr. Begg, speaking of vaccinations, the President gave us an update on that. He mentioned the 31 million doses that have been secured from Johnson & Johnson, 20 million from Pfizer. He says that we'll also be getting some as part of the AU initiative. And then he concedes that, yes, there have been some delays in getting the rollout off the ground, but he seems to be confident that a government will achieve its initial target. Do you think this is possible? We still don't really have the dates in terms of even when the Pfizer vaccines are going to arrive. The President said we're still finalizing the contract.
So I think it is concerning, because obviously we were all delighted when we actually had the delivery of AstraZeneca, and that's always a good sign, that you actually have the vaccines on home soil. And then obviously the bad news that arose around the variant and the impact that we saw in the small study, indicating perhaps a reduced efficacy of AstraZeneca with our variant of 501(2) wide V2 variant. So I think that really did put us back, because the months of preparation prior to the AstraZeneca vaccine is then obviously lost time. We were then able to convert into the Sisonke basis, but the sheer numbers weren't available to be able to vaccine at pace. We certainly are able and have capacity to vaccine at much higher levels even now than we are vaccinating at the moment. We're just simply restricted by numbers of vaccines available on a daily basis. So the reason that we're not vaccinating on Sundays or on Saturdays or all of the days is simply we don't have enough doses to be able to vaccinate at the kind of pace that we actually do have capacity to do. So we just need those vaccines on the ground, and then we will be able to vaccinate at significantly greater pace than we're doing now.
Yeah, and let's hope that's going to kick off as soon as possible. Thank you so much for your time, Dr. Kerrin Begg, public health specialist from the College of Medicine at the University of Cape Town.